Welcome, I'm Dr. Mona. We're doing our weekly COVID live Q&A for Peds Associates, so welcome. And again, we will be saving this. I feel like there is a lot to talk about today. And I'm gonna try to do a short little intro about the big things to talk about and leave it up to you all to ask your questions. Welcome, yes, please wave as you come in, I love it. Welcome, so first and foremost, thank you whoever has shared our page to get us to 10,000 because today we reached 10,000 followers. And if you don't know why this is such a big milestone, 10,000 followers is a lot for Instagram, but also it means that we can get swipe ups. So didn't happen yet. It takes about a few days for Instagram to catch up and get with the program. But 10,000 followers means that we now get the swipe up in our stories. So you know how we have blog posts that we do. Whenever I do these lives, I have articles that I want to share, or I reference different places that I'm getting my data. Now you all can have access to that next week, not this week because they haven't added the swipe up just yet, but we'll save that to highlight. What you can do, obviously if you have a friend or a relative who's like, I don't believe that, and you're like, well, look at this information. I'll give you all of that evidence-based information for you to read later if it's something that interests you. Many of you may just come for this information just for what I'm saying, but I do like to support it with the actual information of where I get this all this content from. So I think that'll be really helpful starting next week. So thank you everyone who has shared the page, shared the lives, tagged friends in it. It means a lot to us. And welcome. I had a great Labor Day weekend. Someone asked me. Thank you. Very nice. Yes. And we're gonna. Things are gonna keep going in the upward swing. Okay. I know it seems a little crazy right now. Still, I'm gonna go over the data first, like I always do. It seems crazy, but there are glimmers of hope every week. So I want to be very positive about that, but we're not in the clear yet. Obviously, we still have a lot of cases and transmission. I'll be going over Florida data. I'll be going over the national data for children. There are obviously concerns that we see. There are glimmers of hope that we see. So I'm going to go over all of that today. I'm also going to be going over testing. People were asking about the accuracy of testing, nasal, oral swab, rapid antigen, PCR. I'm going to be going over all of the information that we have right now. Again, this is not up to date for Delta because they haven't said specifically about Delta, but it's pretty much the SARS-CoV-2 virus, which is applicable to Delta. So I'm not too concerned about it being variable to Delta, but I'm going to give you that information. I'm also going to talk about the AAP's statement on giving the flu vaccine with COVID. And then if you all want to know the updates from the White House briefing, you guys can respond now if it's something you want to know, the ones that pertain to children. I can do a quick update on that. If it's something that doesn't interest you, then you guys can just say not interested. But if people are saying, yeah, tell me the key updates, there's a few things that I wanted to point out as it applies to children and families, which I think is really cool. So if it's something you want to hear about, let me know. Otherwise, you can look it up at whitehouse.gov. Go to President Biden's COVID plan because you'll be able to find out what the big updates are. It's a great plan. And so definitely very exciting to see that. Obviously nothing's perfect, but I really think it's a step in the right direction. So yes, if you're interested, I'm hearing a lot of yeses so far. Yes, I'll do the stuff for children. Sounds good. And I can talk about the Mu variant. What I'll do is, I'm going to do my little spiel first, and then I will leave it to questions. We have until 8:50. So, and then we'll do this again next week. So I'll get through all, and when I answer questions, by the way, I choose questions that I've been getting asked a lot of. So I respect all of your questions. There's no question that's a bad question, but because of time, I like to leave it to the questions that I know people are really asking about a lot in my office, on my social media here. So I'm definitely going to leave it to those questions, but I'll try to get to as much as I can. And as usual, I'm going to get started. Yes, learning about the safety. Perfect. There's so many great questions. Okay. So let's go over data. So 5 million children have tested positive for COVID. We have had the busiest week for children nationwide. 251,000 plus children have tested positive. That's the highest we've seen. Not surprising because you've probably heard it on the news, but that is what the reality was given how prevalent Delta is in the adult population. And because children are unvaccinated, under 12, and some children 12 and to 18 are not, they're going to be a large proportion of the group. So 211,000 was the highest we've seen before this week, and that was in January. So 251,000. we're not plateauing in children, in nationwide. I'll go over the Florida data. I know a lot of you listening are in Florida, but nationwide, we're not seeing a slowdown. You kind of have to look at your region also. So remember, Pediatric Associates has many offices all around the country. I will present Florida data because I'm based here and a lot of our offices are here. But you can always look up your state's data on your state's Department of Health website. Every Department of Health should have either weekly data, daily data. Florida does weekly now. They don't do daily. So for Florida, we have 129,000 cases overall, adults and children, in the last week, okay? That is down from 151,000 the week prior. And again, these are approximations. The positivity rate, again, this is for all people, not just children, 15.2% positivity rate, down from 17%, down from 20.3%. So that is, again, why I'm saying that's reassuring is the positivity rate is going down in Florida. That doesn't mean 15.2 is still very high. It's not, ideally we'd want it under, ideally under 5%, under 10 is amazing. So 15.2, still pretty high, but it's coming down, which is really reassuring. As a reminder, positivity rate means for everyone that gets tested, 15% come back positive. So a positivity rate of 20% is 1 in 5 people, right? So 15% is 1 in 6, 7. So that's really good that it's getting better, but it doesn't mean that it's great, okay? The under 12 years old, the positivity rate is 16.8%, 23,000 cases. That's down from a positivity rate of 19.4%. Between 12 to 19-year-olds, the positivity rate is 21%. That is down from 23,000. So in Florida, these are really reassuring numbers that are saying that it's all going in the right direction. This doesn't mean, remember, these are still high positivity rates, 16.8 and 21.1%. These are still really high positivity rates, so we need to be still precautious, but it's better than where it was. So when I say there's a glimmer of hope, there's a glimmer of hope that, hey, these numbers are going to continue to go down in Florida. So what does this mean for parents and for, if you're a teacher or whatever, anyone who takes care of kids? We still need to take the precautions that we were. This doesn't mean you have to, again, bunker down in your home. This means that you have to really use risk reduction. Masking, vaccinating the people who are able to be vaccinated, right, eligible. So that and masking, thinking about indoor places that you're taking your unvaccinated kids to. If it's like an indoor place that you have a lot of strangers, you don't know their vaccine status, you got to be careful. Masking would be a way to reduce that transmission indoors. If you are with family member and everyone, their vaccine status and everyone's vaccinated, you can decide what you feel comfortable with. But remember, masking indoors does add protection. You can still go to events and stuff indoors, but think about the risk of transmission of just being indoors with a lot of strangers in a crowded place, right? If everyone's masked, that will reduce transmission, but that is how we're going to keep that spread from going even more so. Remember, our children are the large population that's unvaccinated. Some adults are vaccinated too, but we really want to protect our kids from getting this just to avoid any chance of complication, things like that. The hospitalization rate is still the same, 2.4, 2.3%, which is good. But remember, I've always said this, that the data is only coming from 24 states. Not all states are reporting. Florida is one of them, and we do have a lot of hospitalizations. So overall, the data trend is reassuring overall. But what I want to be clear about is that children are still a large proportion of the cases, right? We have 251,000 cases in the last week. That number, we don't know when that's going to start to go down. It's not going down yet. It's likely going to continue to go up nationwide. Florida is just seeing that start to go down, and we were one of the epicenters, right? So think about like if you are in another state that's now seeing the rise. Florida is like your example of like how long this is going to take to come down, right? We finally, after 7 weeks, have now started to see, or 6 weeks, have started to see things start to steady. They're not coming down completely. So in states that are rising, you're going to probably see the same trend. The concern is that if there's more unvaccinated people in the community, that's going to mean that those numbers are just going to skyrocket, right? So remember, numbers are going to go up everywhere. There's a misconception that everywhere, if you are, if there's 80% vaccination rate, that community will not see rises. Every place is going to see a rise, but it's the degree of rise because of the vaccination status. So a place that has a 50% vaccination rate versus a place that has a 90% vaccination rate, you're going to see cases rise in both places, like percentage compared to last week, but you're going to see well more in the lower vaccination communities because there's more bodies that this virus can infect. So that is kind of how you remember. So people will say, well, every place is going up. Well, of course, every place is going to go up because this is a contagious virus and people are unvaccinated. There's children in these places, but it's about the areas that have lower vaccine rates that are going to see more problems. And that is why we are, pushing for the vaccine even more so. And yes, I'm not answering questions just yet. I'm going to answer questions. I usually start like around 8:25. So I'm doing a little bit of an intro. I see that. So I'll start going through questions at the end. The next thing I want to talk about is deaths. We've seen 80 deaths between the age of 0 and 4 to females, 186 deaths males 5 to 18. This is in the United States, not just Florida. 68 females 68 females 5 to 18, and then 152 males 5 to 18. So we are seeing children pass away from this. So people are like, children don't die. They do die. We don't know any of the comorbidities of this right now. This is also on the CDC website, but it's still, remember, any death is a death. So we want to reduce transmission, to reduce the chance of people getting sick, including our children, and including any chance of a vulnerable child getting, passing away from this virus. So that's why we all have to do our part, vaccinate, mask, all of that, to protect our children and protect the people who can't protect themselves. So it's really important that we take that responsibility on us. The next thing I want to go over is the Aap Flu Statement. So their recommendation right now is children can get the flu vaccine at the same time as the COVID vaccine. There's no reason you have to split it up. The only recommendation they also said is that if your child has mild or moderate to severe COVID, meaning they're sick with COVID at that time, you should wait till they're recovered to get the flu vaccine. So if your child has COVID, wait to get the flu vaccine, but if you can get the flu vaccine the same time as the COVID vaccine, no spacing required, and by the end of October is the ideal time to get the flu vaccine. Pediatric Associates currently does not have it. We usually get it mid to late September. We will notify you all, but if you're outside of Pediatric Associates, if you're joining us from some other practice, I recommend getting it. I think that sweet spot is basically end of September to end of October. And I say that because you want to have protection for, most of the season. If you did it already, no problem. But if you haven't gotten it, get it in the next couple weeks, definitely by end of September, or definitely end of September to end of October, just so that you can be covered and that you can be protected latest by Halloween. We want it done by latest Halloween. Doing it anytime in October is when I usually do it. I'm going to go over testing, and then I'll go over the White House summary, and then I'll answer questions. Okay, so first of all, if you all are interested, again, let me know if you want me to write this down in a blog about the testing. I think I'm going to hear a resounding yes, but I just want to see what you all are interested in. I ended up not doing the myocarditis one today because there was a lot of stuff to research on today, so I didn't get time. But if you're interested in testing clinical symptoms of COVID, testing, just shoot a, like heart symbol or something, so I know. But basically, testing. Testing is recommended for a few reasons. Symptoms. What are the symptoms? I'll write this down in a blog if y'all are interested. But symptoms would be fever, fatigue, any viral symptom. Fever, fatigue, headache, muscle aches, cough, congestion, loss of smell, sore throat, any viral symptoms, nausea, vomiting. Pretty much any viral symptom can be COVID, unfortunately, in a kid. The big telltale sign for sure is fever and cough, and older children can say loss of smell. But the reality is some children have very minor symptoms. Some children are asymptomatic. So the recommendation would be any viral symptom in a place of high transmission, and that includes Florida because we still are seeing 16% of people have COVID. You should get your child tested. I know what you're thinking. That's a lot of testing. But in a time where remember, the virus is prevalent, that's when testing is way more important, especially if your child is in school or goes to daycare. I get it. I'm a mom too. I don't want to get tested all the time. But the reality is it's for protecting everyone else, right? We don't want this to spread in our schools. We don't want this to spread in our communities. So the testing recommendation number 1 is symptoms for sure. And I mentioned, I'll write that down in a blog form. No symptoms, but they were exposed to someone with COVID. What is considered exposure? They were exposed to someone who they were within the same proximity for more than 15 minutes, within 6 feet of that person, and both people were unmasked. Okay, so if that's the case, both people were unmasked, exposure. There was a teacher in Marin County, California, who took off his mask to read and exposed his kids. So those people are all considered exposed, right? Because he was not wearing a mask. Both people have to wear a mask, right? For it to be okay. So just say I'm wearing a mask, you're wearing a mask, and I have COVID, right? You don't necessarily require testing for exposure because we were both wearing masks. But if I wasn't wearing a mask, y'all have to get tested. Does that make sense? And I'll write this down again. Now, if that happens, if you're asymptomatic and you have exposure, the recommendation is testing around 4 days of exposure, meaning just say on Friday you had an exposure at a child's school. The reason is if you're asymptomatic, meaning no symptom, but you were exposed, getting tested that first day is not going to give you the most accurate result because your viral load, your virus in your body may not be high enough. So the recommendation is day 4 from the AAP, which is the American Academy of Pediatrics. Day 4 is when we recommend the testing to happen for a exposure. So if they're symptomatic, you can get tested at any point of symptoms, but I'll get into what testing type you should get. But I hope that makes sense because remember, if you have no symptoms, you could still be brewing the virus, but if it's day 1, you could have a lot less virus than if it's day 4, right? So day 4 is that happy ballpark to say, okay, day 4 is the best day. This is tough for school, right? Because then you're gonna miss 4 to 7 days of school. But in the time of COVID, this is why masking is required, right? Because if everyone's wearing masks in school, if someone had COVID, it's not gonna be this whole big production because people were wearing masks. Now, if people weren't wearing masks, then you have to do the quarantine, the testing. So that is why masking protocols are important. So that is one thing about the testing. If the person has symptoms, negative test, right? So symptoms, negative test, no known exposure. So just say someone had a fever, cough, negative test, there was no known exposure. They can return without the 10-day quarantine since they had the negative test, as long as they're in a low transmission area. So in Florida, what that means is if you have symptoms, fever and cough, I'm using that example, negative test, you can return once symptoms have improved. The child is fever-free for 24 hours, acting better, negative test. Same things that we would do for if your child had any virus, right? Just say your child had a runny nose and cough and had a fever. You would be able to send your child back if they were fever-free for 24 hours and acting okay. So it's the same idea, is that you should get tested. If that test is negative and you're in Florida where the transmission is high, you can go back to school with that negative test only if your child is acting well and your child has no fever, right? Using the same rules we use with any virus, but now you have that test. So that is kind of the guidelines. Again, I'll go through more questions. In terms of testing type, so I want to be very clear that the perfect test does not exist. And remember, perfect meaning 100% all the time. There's so many variables. One of the biggest variables is how that test was, the person who took that sample. We talk about nasal swabs, right? Nasal swabs can be done obviously in the nose. There's a technique to get it right. The nasal swab goes up the nose and it shouldn't go up. It should kind of go back a little bit. And it's about getting enough snot on that sample. And it's really important that we go back into the nose to get the sample. And it's not comfortable, but that is very important to get the most virus on that swab. The types of tests that there are, you have your rapid antigen tests, which are 15-20 minute results, and then you have PCR. PCR takes usually 24 to 72 hours. Now they're much quicker, so it can be within 24 hours. Your PCR test is the gold standard. This is the test that has the highest sensitivity and specificity, which I will go over what that means. So when you're thinking about testing, our goal is to always err on the side of a PCR. So if you have symptoms, you or your child should be getting a PCR test. PCR is that most accurate test compared to a rapid antigen, like that's that 15-30 minute one. That is the recommendation. Rapid antigen tests, these are ones that you just, the quick ones, like I said, these can be useful if you need a quick answer, but if you have symptoms, you should be waiting for the PCR to come back. Anyone with symptoms should be getting a PCR. They should not be getting a rapid, okay? You can get a rapid if you want, but if it's negative, there can be a high degree of false negative. Not so much a high degree of false positive. What that means is if you test with the rapid and it comes back positive, it's likely positive. There is a chance that if you take the swab and it comes back negative, you could actually have COVID, but the test is telling you it's negative, normal, right? So that is why if you're symptomatic, fine, you can start with the rapid, but you need to confirm with a PCR if it is in fact Normal, negative, right? Remember terminology. Negative means that they did not detect the virus. If it's positive, you can say it's positive. That's fine. You're going to do your 10 days quarantine. You're going to do that, right? If you want to confirm with the PCR, you can, in case there was a false positive and you're like, I don't believe it, but you don't have to. There's a small chance that there could be false positive, but you want to really confirm with the PCR if it's a negative test and you are, having symptoms. Now, I want to go over the sensitivity of saliva tests versus nasal for PCR. So there are options to do the oral mucosa one, meaning you just swab the back of the throat, or you do the nasal one. A lot of the ones that I have done for Ryan have been the oral one lately. We do it if he gets like a little runny nose now. We've been really diligent about this. And so for the sensitivity, and I want to remind you what sensitivity means. So this means that there are a few false negative results, meaning what we are seeing is that when people are testing negative, it's truly negative. It's not like, oh, they actually had COVID. So that's it's a very sensitive test. They said that it was about an 83% sensitivity of the saliva compared to an 84% sensitivity of the nasal. For specificity, this means that they're correctly, there's few false positives. For this one, it was 99% specific for having COVID and actually being COVID, versus a 90 for the saliva versus 98 for the nasal. So in terms of specificity, the nasal one was actually more specific. The throat one was more specific. So this is actually really reassuring stuff that it actually can be either the oral or the nasal for the PCR. So I would 100% recommend either. People were asking last week about the oral versus the nasal. Totally fine, but it should be a PCR test. That is the highest recommendation. There was not data on all of the rapid home tests because not all of them submit data, but the rapid home may just be a quick antigen test. It may not be a PCR. When can this be useful? Rapid antigen test can be used for quick, I wasn't exposed and I'm not symptomatic, like a screening test. So it's okay to use those home tests, right? If you have no symptoms and you're not symptomatic, right? And you weren't exposed to someone. Okay, that's when you can use that. So schools may start to use rapid antigen tests, the 15-minute ones, right? There is a utility in having these rapid antigens. So don't think that it's never useful, but we got to think about, okay, if I'm at home and I want to do a home test, but my kid has symptoms, you probably want to get a PCR to confirm that false negative, right? If there is a negative. If it's positive, great. But that is kind of how you should approach it. I think having home negative tests is great if you're traveling. Just say you're traveling, no symptoms, no exposure, like what I was saying, you could do a rapid at home. Make sure that everyone's okay for travel. That is what a lot of other countries do. But if you are symptomatic, if you were exposed, you should be doing the PCR, which is the more accurate test. And I'll do a blog post about this. Okay, so now I will go into the quick and dirty White House update. The biggest thing that relates to children was the school one, okay? So I'm going to talk about the school one. Requiring vaccinations for school teachers, for all employees, not just the school teachers, which I'm all for. This is a approved vaccine. Remember that there's a very small part of the population that is truly allergic to vaccines and won't be able to get it, but this is so small. These people will get exemptions. Don't worry about these people. Everyone's always worried about people and they're like, well, that's not fair to them. I'm like, if that's not you, you're just not supportive of the vaccine, so that's why you're upset. But they're not gonna we know when people are not allowed to get vaccines, but you have to get the vaccine if you're gonna be around children. I mean, that's kind of the recommendation. And so that's one of the things. They're gonna now give money to any states that have been with restricting money from schools because of mask mandates. That was happening in Florida. The federal government is going to support these schools to create policies. So pro-health, public health policies. So very fantastic news. The goal is in-person instruction. Every pediatrician wants this. I would hope every parent wants this too. We want our kids to be together. We do not want them to be apart. And in order to do that, we have to have common sense rules. We have to have masking requirements and vaccination requirements. Getting students and school staff tested regularly. Doing the rapid antigen would be a great way to do that. And then again, expediting and assuring review of the COVID vaccine for under 12. So of course that's a priority, right? Because we need to vaccinate our kids under 12 and make sure that the vaccine is approved and safe and authorized. So these are all really important things for kids. Very exciting. It is not overstepping. People are like, it's overstepping. These are policies that are in place in every other country that has seen COVID be squashed. So this is not infringement of rights. This is a public health emergency, and we need to do these things. Remember, it is an approved vaccine. So it's not just an authorized vaccine. And even when it was authorized, it was still a great vaccine. So we want to really stop this and protect our kids. Remember, we're trying to protect the people that cannot protect themselves. And in order to do that, the adults need to play their part. And then, of course, some testing and masking requirements as part of that in terms of fines if you're traveling and not wearing a mask, doubling the fines for adults who are not wearing masks if you're traveling and you refuse to wear your mask. So these are all important things. And by the way, every developed country that has seen COVID go down in numbers, New Zealand, Portugal, Europe, other European countries are setting these rules. So we should not, this is something that should have happened a while ago. So it's very nice to see it happen because we need to get out of this. So very exciting. I will do about 25 minutes of questions now. I'm going to scroll up. Let's see. Okay. And again, I'm going to go over the major ones that I'm getting. Okay. And if I don't answer it, it's not personal. Don't take it, I have to do the ones that are like really popular ones. I'm just scrolling. Sorry. Do you know anything about the efficacy of PM2.5 mask filters? In general, the recommendation is filters are not necessary. That's actually been said time and time again. Like in terms, I don't know what the PM2.5 is, but you just need a basic mask that you can, like N95s are great, but for your children, you can do a KN95. Really, it's a mask that they're gonna wear. That is what I want for you, okay? A mask that they're gonna wear is the best mask. The Mu variant. So right now, the Mu variant is not much to talk about right now. It's something that we're keeping an eye on, but it's not as concerning right now as the Delta. I, of course, will bring that up. We were watching Delta, so now we'll keep watching the Mu variant, but I'll keep you posted if there's anything to keep you posted about. Is there any antibody test approved for 2 years old? No. So I went on the CDC website. There is not one that's officially approved. And I talked about this last time. The reason is that we still don't know how long immunity lasts for, so we don't want false security. Does it mean that you get full immunity from the Delta variant if you have antibody positive? So there's no recommendation to test antibodies for kids. Let's see. I thought WHO said no kids, no boosters. Okay, I want to explain what's happening because I think it's an important policy piece. So the World Health Organization is very different than saying different things than America. I want to explain why. America has resources. So we have the resources to have vaccines. We are producing vaccines in mass amounts. The World Health Organization is looking at policies that benefit the whole country or the whole world. And so the reason why they're saying that is not that it's not medically needed. It's obviously medically needed. It's that they are trying to vaccinate people who have not even been vaccinated yet, right? So yes, when you look at America, in a way, we should be very fortunate to have access to these vaccines when we know that many people don't have had an opportunity to get their first vaccine, even if they want it. And America is actually helping fund vaccine efforts for other countries right now. Okay, they're shipping vaccines all over the world. So when the World Health Organization is saying that, it's not because it's not medically needed. It's because they're trying to focus on people who need it first from a global perspective. And so when they bring those policies and disagree with America, there's a clarification here that we should be doing this, but the whole world doesn't have access to this. So when someone in another country is looking at America and we are all on our third vaccine and children are also getting vaccines, it doesn't seem fair. I agree that we have access to this and they don't. So in how I look at it is I don't think we should feel bad that we have access to this. I think we should feel grateful and understand what privilege means and respect that and do our part to stop the spread of this virus, right? So don't look at it as like, well, okay, I'm going to ship my dose to a person in another country. I would love to do that too. But if a vaccine is offered to us, to our children, that's safe and effective, we should take that opportunity, have gratitude for it, right? Respect the fact that we live in a country that is able to give us this for free and in drive-up pharmacies, have that gratitude, and do our part in the community, in the world, to stop the transmission for people who can't do it right now. That's how we look at this, right? Of course, the World Health Organization is going to say that, and I don't blame them because they want to look at this as a global picture. But we should be vaccinating our children, 12 up. We should be getting boosters because that's what the science shows. But unfortunately, most of the world does not have access to even their first vaccine yet, their second vaccine, testing, right? And I'm talking about developing countries. And America is doing their part. Other developed countries are trying to do their part too. And we have to take care of ourselves and also look out for other people, but we also have to do that in America with our own countrymen, right? Like you have to remember this is why this is all happening. So to say like, well, the WHO doesn't recommend it, so I'm not doing it. No. You need to do it because this is how it's going to stop around the world, right? Everyone who has access to a vaccine should be getting a vaccine. Everyone that can put a mask on their face should be putting a mask on their face. We need to be doing this so that we can stop this virus from spreading. And that means that, remember, this pandemic is not going to be over until every country gets this under control. Because travel is going to happen. People are going to keep transmitting this. This is going to be this is part of our lives. I mean, I hope you all understand this now, that this is not going away. This is going to be endemic to us. So now we have to understand, well, what can I do to reduce risk and keep my neighbors safe? When I go to travel to another country, how can I keep these people safe, right? You got to remember that. And that is why it's different from the World Health Organization. It's not that it's not needed or it's not bad. It's that we have access and they're trying to protect more people in terms of global principles, but we're not overstepping ourselves, right? We have access. We should hold gratitude for it. And we should say, when you get that shot in your arm, I'm so grateful to live in a country that gives me this opportunity, and I'm going to do my part by sharing information that's correct. I'm not going to spread misinformation, and I'm going to help the world get rid of this virus. Swim lessons. So that's personal choice. There's no AAP recommendation on this. I think it depends on your comfort level, and also maybe if they are able to check vaccination status. I personally would be fine with swimming classes if that instructor was either I knew their vaccine status or they were wearing like a face shield. Remember, face shields are not perfect. It's hard to wear a mask in the pool because if it gets wet, it's kind of uncomfortable. But remember, I do take my son to a swim lesson that has the instructors wear face masks. I don't know their vaccination status. It's a personal choice I made. There is no official recommendation on that I know of. Any ideas when they will start vaccinating under 12? Not yet. They were saying end of September, maybe authorized, but I'm hoping for the late fall or early winter. I'm hearing that it's very hard to get tested now. Where should we go for tests? Do we have to go to the pediatrician? So I wanted to, I don't know where you're asking that question from. Hold on. COVID test. So there is I'm drawing a blank on it. I want to I'm going to find a document. One of my friends was crowdsourcing like a list of where to test children. I'm going to see if she's updated that. In Florida, right now, it would be like I go to Joe DiMaggio's Children's Hospital's website. They have a list of, in South Florida, all the testing sites. I'm sorry, I'm drawing a blank on home testing. There are some private companies that do home PCR testing, do the oral swab, and I'm just drawing a blank on the names right now. But you can look up home testing. I'm okay with any home testing, any testing that your insurance company provides that is home and PCR if they have symptoms, right? But COVID also has, CVS also has home kits. Walgreens does, Walmart. These are all now going to be more affordable according to the White House plan. That these rapid antigen tests. But if you need it for symptoms or exposure, your PCR, and there are you can call your insurance company or go online to Joe DiMaggio's website to get more information. What do you think about children who can't be vaccinated being around vaccinated people who are following other precautions? I think this is the best thing we can do. So what do you think about that, right? That's what I do, right? My son is not able to mask or be vaccinated. And how do I protect him? By socializing with people where the adults are vaccinated and the children who are too young to be vaccinated are able to wear masks when they're in public, right? So you're reducing your risk that way. So I think that's fantastic. I think you're reducing your risk by that person is taking precautions, masking, social distancing, also vaccinated. You're reducing your risk for your child. So I think that's fantastic. My son has COVID. How long do I keep him isolated? Great question. So the recommendation is at least 10 days from the onset of symptom. If there was no symptoms, 10 days from the positive test. Okay, so 10 days from the first set of symptom, 10 days from the positive test if asymptomatic. Minimum 10 days, okay? 10 to 14, but 10 is the CDC recommendation. The other rule is that they have to be fever-free for 24 hours and back to feeling like themselves a little bit. They don't need to be perfect, but they need to be like close to baseline where you would feel comfortable sending him out into the world, taken care of by someone else, right? Not, not dehydrated, active. You want all of those things. From your experience, do you see most of the positive children age infant to 8-year-old has mild symptoms comparable to cold, or is it bad? Look, I'm seeing a blend. So I'm seeing, remember, I'm an outpatient. I also have colleagues in inpatient and friends in the ICU. It is uncanny how different it is. What we still are seeing, and this is on, again, when I get my swipe up next week, I'll add all of these resources. What we are seeing still, children who are of unvaccinated parents tend to have a harder outcome. There are more severe symptoms, and that has to do a lot with viral load, like how much virus is in their body. So unvaccinated parents tend to be more sick kids, hospitalized, and obesity is still a risk factor for hospitalization and being sick. So obesity, unvaccinated parents, and ethnicity-wise, according to the CDC data, Black and Hispanic. That is what I reported last week also, still the case. That is just from, again, data that we currently have right now. Remember, that does not mean that if you are a child of a vaccinated household, you're in the clear, that you are, if you're not Black or Hispanic, you're in the clear. It's just looking at the trends. So we still, even though those groups are considered higher risk for complications, I still want all of us to think about risk reduction, right? Because one, I don't want it to get the virus to get to anyone who's high risk. And also, I don't want that chance that your kid ends up being the child of a vaccinated family who has no obesity, is like the no risk factor, and ends up getting super sick. So we just want to be precautious as much as possible. Remember, my blend and my style is risk reduction. And what I mean by that, and I'm gonna miss saying that phrase when this pandemic is done, not really, is thinking about any activity you're doing. I want to do this activity. It's important to me. How can I do this activity with risk reduction to reduce risk of me getting this, my child getting this, and spreading this? Wearing masks, going in hours that are not crowded. Also think about, is that activity really necessary for my well-being and for my mental health, right? If it's really needed, what can I do to reduce risk? So I want to use the example. Me and my husband have started, we go out to dinners. We always sit outside, right? Risk reduction. We wear our masks when we get into the elevator, right? If it's we have an elevator. We look for places that are more outdoor. These are the things that we do to reduce risk, to keep our lives, but to also remember that even though we're both vaccinated, we don't want the chance of breakthrough. We don't bring our son out to restaurants right now just because of how bad Delta is. When Delta gets better, we will probably start taking him out to restaurants. But right now, we will, we'll have a nanny watch him or something. But that's the thought process. You want to think about, well, what can I do to reduce my risk so that I don't bring this home to my child and I don't spread this? Let's see. Great questions, everyone. Yes. Let's see. Yes, and thank you for everyone who's standing up for the community to learn. I don't really respond to trolls. And again, a definition of a troll is someone who just comes here to stir up the pot and is not really interested in learning. They're just here they have nothing better to do. So I'm not going to entertain your comments because it's not really necessary and you're not here to learn. So I think there's other things that you can do with your evening than be here. So let's see. I'm just going again. Do you see the Delta variant wreaking havoc in Northeast or not as much with higher vaccination rates? So we are seeing, again, like I said earlier, we're seeing it affect largely unvaccinated communities with the understanding that, of course, every place can get this. But when you look at the map, the whole country's red right now because red means high, like increasing transmission. But the rate, like the positivity rate, is much less in places with higher vaccination status. So Florida is much higher than New York, than California. You're still going to see positivity rate go up than what it was 2 months ago. But yes, it is better. How to protect infant if you have 6-year-old going to school? I hope your 6-year-old is wearing a mask. I hope so. That's going to be one of the best things you can do. And then when they come home, hand washing when they get home. You don't really need to change out. If you want to, you can, but I'm more worried about respiratory and germs on the hands, picking nose, all of that. That's how we spread germs. So that's going to be your best thing. If we got Moderna 2 shots, should we get Pfizer booster or wait? The recommendation is sticking to the same one. So I would recommend just waiting for the Moderna. When they approve it, it'll probably get approved soon for that, because remember, Moderna was approved a little later than the Pfizer, so it's probably coming. You're so welcome. Thank you for answering that question about the flu vaccine. No problem. School district is asleep at the wheel. What guidelines do you think are most important for elementary school? And okay, you're just asking about what I think is important. Yeah, I think in my ideal world, I think one of the biggest things that we should have is universal masking for anyone who's able to developmentally wear a mask. I say this with so much understanding that we have, when we talk about neurodiverse community, autism, some children cannot developmentally wear a mask, right? But in order to protect them, in order to protect every child, anyone who's developmentally able to wear a mask should wear a mask. I would love vaccination requirements. That would be an ideal world. I would love testing if anyone's obviously having symptoms, they have to do the testing. So we need more. In my ideal world, if I was running for president and I was in charge of this, or school board, I would have masking, and I would have access to testing. And not this where the hell do I go for testing? It needs to be more accessible. I agree. It's very frustrating, the testing that's happening in Florida everywhere. It's like, my son, who's 20 months old, I used to go to an urgent care, and now we do these home tests, which I will find the name of this for next week. But we were going to urgent cares for now, but now for the next time we're going to be doing this home test if he needs it. But it's stressful because you have to wait and stuff like that. We need better testing, and they closed down the testing sites in the state when things were getting better, and they didn't reopen many of them up, and our children are left at a disadvantage because of this. Yes, blog. Okay, I will do a blog next week. Again, if I don't, it's because there's so much content to go over for the live, and you probably don't imagine how much time that takes to make sure everything's in order. But that is on my to-do list. I promise. Perfect. I'll do a whole thing about testing. It's going to be fantastic. And again, all the information I give is for the moment. Things may change, but at least you'll have that. Do you need to go to a pediatric clinic hospital to test small children, or would a normal testing site? So certain testing sites will say 3 and up, all ages. Mills Pond Park is one of the testing sites in South Florida. They do all ages. I know that. I don't know where that is in proximity if you're in South Florida, but you need to make sure that they test your age child, because some of them don't do it just because of technique. They just don't feel comfortable. We need to make sure it's the age of your child. So you can look at that on the Department of Health website for your state. Or if you have access to that, again, Joe DiMaggio's Children's Hospital website for South Florida has the ages listed too. Can you take the vaccine while pregnant? Yes. All major pregnancy organizations, so ACOG, fertility medicine, vaccine is safe to take in pregnancy and while you're breastfeeding. Saliva test is that throat test. So what about the saliva test? Can my daughter use that? Yes, that is a PCR. I want it to be a PCR test. Remember, your gold standard is PCR, whether it's a oral in the mouth or nasal. PCR is your gold standard. I would always try to go for a PCR if you're symptomatic or if you've been exposed. If you're just doing this for screening, you have no symptoms, you weren't exposed, you can start with the rapid. No masks at my son's school, just temp checks, and our positivity rate is down to 1%. Where do you live? Oh my goodness, Nails by Just Rose. I need to go there. Amazing. Look, the information is going to change as what your positivity rate is doing, right? So I'm giving you overarching things, but positivity rate is a huge indicator of recommendations. When I mentioned the testing requirements, if you live in a community that has 1% transmission rates, I'm not going to be as worried that if your child has a runny nose, you have to get them tested, right? Because it could just be any runny nose, unless they were exposed. But in Florida, I'm acting like everything is COVID because our positivity rate is 16%. In 2 months, that will be a different story. But you have to remember that your advice goes by where you're living. If you are confused about what your positivity rate, you can ask your pediatrician, or better yet, just go to the Department of Health website. Wherever you are, they should have it in their weekly COVID data or daily COVID data. Ideally, I would want it under 5% is the goal. For that means it's not transmitting high in a community. So look at that, if that'll help you. Again, we don't have links to every Department of Health website. Maybe if I have time, I'll talk to my team. I can get all the links for every state in the country, which would take a long time, but we could do that. And then that way you can look at your positivity rate by state to state. And then you guys have to share this account because that's where you're getting all this information. Again, everyone, so many people are asking questions about when it's going to be approved for younger kids. We don't know. I don't want to give you false hope. I mentioned this before. It's like when you go to a restaurant, they tell you it's going to be 5 minutes, and then it's like 2 hours. You're like going to be mad. So I'm just going to tell you it's going to be 2 hour wait, and then maybe it'll be 10 minutes. So you never know. Yeah. Let's see. Okay, guys, let's see. Are you from Cameroon? No, I'm from India. Well, yeah, I love these questions. I'm Indian, but there's a lot of Indian people in the islands. But yes, my family's from India, but I grew up in California. So many random questions. I don't know. Hey. Okay. I live in a free country with my... Okay, what about... Sorry, I'm just scrolling. Should we keep our dentist appointment? Great question. Should we keep our dentist appointment if first appointment of the day? How can we make it safer? My son has his dentist appointment on Monday. We're gonna go. I'm not worried about it. Remember, the dentist is wearing a mask, so that's great. You're wearing a mask, right? I'm not worried at all. I have zero concern about going to the dentist. I'd be more worried if the dentist had his or her mouth open in front of your child's face, but they're not. They're wearing masks, and a lot of them are wearing N95 masks, but N95 is the ideal, and a lot of them wear face shields on top of it. If you don't have the face shield, that's fine. I have zero concern taking your child to a dentist, zero, to the point where I've gone every 6 months for my son in this pandemic, and we're going on Monday. So go to the dentist. Dental health is important. It's like going to the doctor, and as a fellow dentists are doctors, they are taking the precautions we are, and I would have no problem. They are wearing masks. Get your teeth checked out. There's a lot of people who I don't know why you're here. I don't understand. Really, there's other things you can do with your evening. And I'm not answering those questions. Let's see. And honestly, I'm gonna be very honest. The trolling, we have no patience for it because we're working in this, right? My husband's an ER doctor. My husband's an ER doctor. I'm a pediatrician. We are seeing the worst of the worst in terms of people dying from this and all the hardship it's causing. And the funniest thing about all this is everyone's being hospitalized with COVID. No one is being hospitalized for vaccine-related illnesses, right? So meaning the vaccine injuries. So people need to understand what's the perspective here. People are dying from this virus. And so we're always going to promote pro-science. Pediatric Associates always will. We'll always present the data here. This is what this platform is for. And I love doing it because it's so important that you hear it from the right people. And I am not going to respond to any of that. And I just kind of scroll up. I mean, I really feel sad that you have to be here, and you really should do other things with your day. I really am sorry that you are so bored. Let's see. Could you share the name of Ryan's dentist? Unfortunately, I can't because it's a public platform and for privacy reasons. I'm sorry, I can't. Sorry, I wish I could, but it's kind of like a privacy, HIPAA issue, yeah. The testing info was so helpful. Yes, everyone, I'm just trying to get to another question. I'm gonna do one more question. Everyone has a lot of the same questions today. Dentist. Vaccine for child with special needs, your thoughts. I would support it. Now, remember, I don't know, I'm not going to ask what the special needs are, but there is in terms of special needs can mean so many different things, but if your child has any genetic condition, neurological condition, breathing condition, things that would make it hard for them to fight a respiratory condition, sickle cell, these are all risk factors for children, so 100% recommend it. Every child should get vaccinated. There is no child that's contraindicated to get vaccinated because your risk of getting COVID and complications in that population would be much higher, but every child should be vaccinated when they're age appropriate. So 12 plus right now, we do not have the vaccine available for under 12, so don't get it for under 12 right now. I'll do this last one. How do you suggest protecting newborns? This is a great one. So remember what I was saying about the positivity rates, right? You have to go back to your positivity rate. So I'm going to use two examples. I'm going to use the example of that follower here that has that 1% positivity rate, and Florida that has a 16% positivity rate, okay? The follower who is in this, for me, the 16% positivity rate, transmission is high. In this aspect, I'm going to be extra cautious, which means I'm going to ask every visitor to mask. This is my recommendation because positivity rate's high. You don't know who's carrying it, and that includes vaccinated family members. Newborns are so immature in their immune system. I would hate that breakthrough happens, spreads it. The chance is low, but it's an easy thing that we can do to mask visitors. Other option is outdoor. You have a visit with everyone outdoor, right? That would be a place of high transmission. Immediate family members, meaning you and your partner, grandma, anyone who's taking care of the kid, if they're vaccinated and they're there day to day, you can decide what you feel comfortable with. I'm talking about the random person that's coming to give a gift to the baby. But if it's a primary caregiver, you, your partner, grandma who's staying with you, who's not going out to restaurants and bars and anything like that, or a nanny who you talk about COVID precautions, you can decide what you feel comfortable with. Obviously, if anyone's under the weather, runny nose, cough, anything like that, they shouldn't visit or be there, or wear a mask if they're not feeling well. But that's the recommendation about newborns. If you're in the 1% transmission, I'm not as worried, right? Because it's not transmitting high. So if you're in those communities, you can go by, if you're vaccinated, visit my baby, maybe keep groups small, right? If you're unvaccinated, you're likely not going to be having the COVID or having COVID because the transmission is low. But if you're ultra concerned, you would mask the unvaccinated, right? Think about those things. So if it was me in I'm going to tell you what I would do. In Florida, if I had a new baby, I would limit visitors to only people who need to be here right now, meaning my mom who needs to help me, those people. I wouldn't mask my mom because she's vaccinated and she would just be helping us in the house. She's not going to be going out and gallivanting. Visitors, if people wanted to visit, I would probably hold for the first 2 months. I know that sounds a little hard, but they can see the baby when the baby's awake and doing more. I just feel that way. There's really no reason right now. Maybe if someone wanted to come and see me, they could come and see me, wear a mask, right? Because we're in Florida. If I was in that 1% transmission, I would probably do the same just because that's my philosophy on visitors for newborns in general. But I would allow visitors, maybe I'd be more lenient on random people coming that I know their vaccination status, but I would only allow people into my home, even in that 1% transmission, who are vaccinated. I would not allow people unvaccinated into my home to see my newborn baby, even in a low transmission state. That's just my philosophy because I want people who are taking precautions around my child and I don't want that risk. So that's kind of how I look at it. These are great questions, everyone. Well, this was great. Are you worried about cases being underreported due to everyone taking home tests? Yes. Remember, I not even just from the home test. I'm also concerned because not all states are reporting data. So when I say the data, it's relative to the data we had in the past. It's not completely accurate. So meaning it doesn't reflect, it's likely a lot more. The other thing though that I will like to say is that there is a chance that we could be seeing an even lower positivity rate. Why? Is that maybe if we did more mass testing, that would be more people getting tests and your positivity rate would go down, right? So it is a lot of statistics, it's a lot of information to kind of digest, but there is a lot of things that we have to remember that data is good, but when you're doing testing data, it doesn't encompass everyone who's getting tested. And if every child got tested on a regular basis, like some countries do by the way, okay, we would have more accurate positivity rates, meaning if we were testing everyone, then everyone, just say there's thousands of people getting tested, your positivity rate could be lower because you're testing more people and you're realizing that not everyone has this, right? Because maybe the people who are seeking testing have symptoms, right? So that's kind of the thought process. Everyone, thank you so much. I'm gonna save this. This was a great turnout today. We'll do this next week again. We'll have swipe ups. Hopefully Instagram will remember that needs to happen. And what I will likely do is after the live, I'll do the live and I will add the swipe ups, the pertinent swipe ups to next week's live, right? So, and then we'll save those. So every week now we'll add the pertinent swipe ups. I'll do the ones that really make sense, not to bog you down. You can decide what you want to read. You can decide what you want to share with people. But I want you to know that all of this information comes from evidence-based articles. All this information comes from CDC, AAP, but also an understanding of what's happening clinically. So it's really putting it all together. So that's what we're here for. So we'll see you next week. Yeah, you're welcome. Thank you for everyone with all the supportive comments and people who are really, here to learn. It really means a lot for us. So thank you so much.